The fourth topic of the talk is specifically about patients in remission and when we discontinue treatment. I've brought two articles that I find relevant. The first evaluates the efficacy and safety of biologics in the 2022 ASA EULAR Guideline Systematic Review. And on the other hand, I also found it relevant that this other article discusses whether it is more effective, the effectiveness of tight control and the treat-to-target strategy in patients with spondyloarthritis compared to standard treatment reviews. And the conclusions of these articles were quite the opposite of what I expected, which is that tight control and the treat-to-target strategy did not prove to be more effective. Thank you. Than the standard treatment. That is, they did not find a statistically significant difference in the primary endpoint they had set, which was an improvement of at least 30% in the ASAS-HI. However, the treat-to-target strategy and tight control treatment did show favorable results in the secondary endpoints, for example, an improvement in ASAS-20 and ASAS-40 compared to standard treatment. Those would be the conclusions of the first article. And regarding the second article, in terms of the definition of remission, I did not find a standard definition. However, it is accepted that a NASDAQ score below 2.1, indicating low disease activity or inactive disease for at least 6 months, qualifies. And the article tells us that regarding treatment discontinuation, they studied anti-TNF agents and IL-17 inhibitors. Ixekizumab proved to be ineffective and led to an increase in disease flares. Therefore, in patients with remission or low disease activity, it is better to space out the doses of anti-TNF agents, rather than stopping the treatment completely. And other conclusions from this article, which I found interesting, were that IL-23 and IL-12/23, the inhibitors of those interleukins, did not show efficacy in the treatment of both radiographic and non-radiographic axial spondyloarthritis. And that monoclonal antibodies against TNF-alpha are associated with a reduction in uveitis when compared to etanercept or secukinumab. Therefore, in patients in remission, when we stop the treatment, I would have liked to find an article that told me, Alicia, stop the treatment after 1 year and 3 days. But I haven't found one. So what I most definitely, yes. It seems that we should absolutely space out the doses indeed before stopping the treatment.